The face and neck are vital areas of the human body, housing crucial structures responsible for various functions. A thorough assessment of these areas is paramount in healthcare for a multitude of reasons. It allows healthcare professionals to evaluate the overall health status of a patient, detect abnormalities, and monitor the progression of existing conditions. Imagine a patient presenting with facial drooping. This seemingly simple observation could be a telltale sign of a stroke, demanding immediate medical attention. Or consider a patient with swollen lymph nodes in the neck. This finding might indicate an infection, or in some cases, a more serious underlying condition. Early detection of abnormalities in these areas can significantly impact patient outcomes. Therefore, a comprehensive understanding of face and neck assessment techniques is crucial for all healthcare professionals, enabling them to provide the best possible care for their patients. The face, with its myriad of expressions, also serves as a canvas for our health. Observing the face involves more than just a cursory glance. It requires a systematic approach to detect subtle signs that might otherwise go unnoticed. We begin by assessing symmetry, a fundamental aspect of facial anatomy. Is one side of the face drooping? Are the eyebrows symmetrical? Any asymmetry could indicate nerve damage or underlying muscle weakness. Next, we inspect the skin, paying close attention to its color, texture, and any lesions. Is the skin pale, flushed, or jaundiced? Are there any unusual moles, rashes, or sores? These findings can provide valuable clues about the patient's circulation, oxygenation, and overall health. The eyes, often referred to as the windows to the soul, are equally telling when it comes to our physical well-being. We examine the sclera, the white part of the eye, for any signs of yellowing, which could indicate jaundice. The pupils, too, hold valuable information. Their size, shape, and reactivity to light can reveal neurological function. Moving on to the nose, we check for any signs of obstruction or discharge. The nasal mucosa, the lining of the nose, can indicate allergies, infections, or other respiratory issues. By carefully observing these facial features, healthcare professionals can gather a wealth of information about a patient's overall health. The neck, a vital pathway connecting the head to the rest of the body, houses numerous critical structures. Just like with the face, assessing the neck begins with an evaluation of symmetry. Does the head tilt to one side? Any asymmetry could point to muscle imbalances or structural abnormalities. The skin of the neck is examined for any unusual markings, lumps, or bumps. Lymph nodes, small bean-shaped structures that filter out toxins, are palpated gently. Swollen or tender lymph nodes can be a sign of infection or other underlying conditions. The thyroid gland, a butterfly-shaped gland located in the front of the neck, plays a crucial role in regulating metabolism. We palpate the thyroid gland to assess its size, shape, and any tenderness. The carotid arteries, located on either side of the neck, are responsible for supplying blood to the brain. We listen to the carotid arteries with a stethoscope to detect any unusual sounds, called bruits, which could indicate blockages or narrowing. Range of motion, the ability to move the neck freely in all directions, is assessed by asking the patient to perform specific movements. Finally, the jugular veins, responsible for draining blood from the head and neck, are inspected. Section 4. Techniques for effective assessment. Assessing the face and neck involves a combination of techniques, each providing unique information. Inspection, the simplest yet most crucial technique, involves visually examining the area for any abnormalities. Palpation, the use of touch to assess the size, shape, and texture of underlying structures, is another essential technique. It allows healthcare professionals to feel for any lumps, bumps, or tenderness. Auscultation, listening to sounds produced by the body using a stethoscope, is primarily used to assess the carotid arteries for any bruits. Mastering these techniques is essential for any healthcare professional involved in patient examination. Section 5. The importance of a systematic approach. A thorough and systematic approach is crucial for accurate and efficient face and neck assessments. Healthcare professionals should follow a consistent pattern, starting with observation and progressing to palpation, auscultation, and percussion as needed. This systematic approach ensures that no area is missed and all relevant findings are documented. Section 6. Additional tips for healthcare professionals. Here are some additional tips for healthcare professionals conducting face and neck assessments. Ensure patient comfort. Create a relaxed and comfortable environment for the patient to minimize anxiety and facilitate cooperation. Explain the procedure. Before beginning the assessment, clearly explain the procedure to the patient, addressing any concerns or questions they may have. Use appropriate lighting. Adequate lighting is crucial for accurate visual inspection. Ensure the examination area is well lit to avoid missing subtle findings. By following these tips and employing a systematic approach, healthcare professionals can enhance their assessment skills and provide the best possible care for their patients.